Good afternoon and welcome to Let's Talk on WIN TV. I'm your host, Denise Rolark Barnes, and I apologize. We are a couple minutes late and we don't like to do that, but we got a lot of different things going on here. Hopefully you've been able to check out some of our WIN TV live segments. They run throughout the week. And we've had a couple of great conversations this week, and I'm looking forward to our conversation today. I'm excited that we're going to have Lauren Burke, who is the founder and publisher of Black Virginia News. It's a digital newsletter focusing on issues of Black voters in the state of Virginia. And Lauren has also been one of the national correspondents for the National Newspaper Publishers Association. So clearly, we're going to be talking to Lauren about Virginia's upcoming elections next Tuesday and how that will define Virginia's future. So we're going to have her on as a pre-election analyst and then bring her back next week, hopefully, to again give us some analysis of the voter turnout, the results of the race, and all of that. Virginia is our neighbor. There's a lot going on there, and a lot to our city's dismay. A lot of folks cross that bridge, one of those bridges, to go to Virginia regularly. So it's all part of the DMV. And as a Washington Informer, we like to cover that community as well. So I'm looking forward to talking to Lauren Burke in a few. Before then, though, we're going to talk to Adrian Jordan. We're talking about health literacy. And Adrian Jordan is the president and CEO of Wellpoint, DC. And he, along with Janita Fowler, founder of Medical Ascension, which is a youth initiative that helps young people explore healthcare careers through mentorship and real-world experiences. So we're going to talk to her, as well as Jimmy Williams, who's the president and CEO of the Washington, D.C. Literacy Center. So talk about how literacy and health literacy intersect in daily life. So I think we have a pretty full show today, and I'm glad that you're with us. Sit back, hold tight to your seats because the wind is gusting out there. Fortunately, we do have sunshine, but the wind is gusting. And so we don't want you to get blown away before the show is over. Before we get into our conversations, make sure you picked up a copy of the most recent issue of the Washington Informer. Again, the paper was published. We publish every week, every Thursday. So make sure you pick up a copy of the Informer. And this week, I'm it's funny, we posted something, or a lot of people responded to a story that we wrote that was published online about the shootings at Howard University. And if I can give my own opinion, I would amplify those voices who were concerned that this only helped to amplify the negative story about Howard's homecoming. But I am very proud still to say that in this week's Informer on page 1, we talk about how Howard University is celebrated its 101st homecoming, focusing on alumni, the importance of alumni, the importance of HBCUs, the importance of safety around HBCUs, and the importance of Black culture. So we try to be a little bit more holistic as opposed to alarming folks over the negative things that happen in our community. And this is one of those examples. So I'm hoping that that person or those individuals will also get a chance to look at the paper to see the real story that we also told about Howard. And of course, we also recognize Christopher Alberts. He's the 2026 Teacher of the Year over at School Without Walls. And so I know that they're excited about that. We've heard news about that, but we did a story on that as well. And then again, more stories about the government shutdown, the impact on DC residents. Sam Collins, James Wright, and Jada Ingleton, 3 of our reporters, collaborated on that story. So please pick up a copy of the Informer. But if you don't get it, the printed copy, you can also visit our website at WashingtonInformer.com, where you can read the stories about what we've published in this week's edition and all the other stories that we've published throughout the week. So if you go to the website, access is free. And we encourage you, we invite you, we want you to become a subscriber to our digital edition. So make sure you do that. You can receive the publication in your inbox, along with daily news updates and our exclusive Win Daily, which is our daily newsletter. All of those things we're doing to keep the community informed. But we need your support, and we hope that you will, as I said, just consider becoming a part of the Informer family. All you got to do is put your email address in that little slot right there, and it's all done. So, while tuning in today's show, we also hope that you'll spread the word and share this broadcast on your social media platforms. You can also follow us on Facebook, IG, X, TikTok, LinkedIn, and YouTube. And I thought we were on Nextdoor, but we are going to be on Nextdoor really soon. So we want to make sure that you, uh, follow us there, as well as Blue Sky, because I understand we're there as well. It's not on my list, but I think we're on Blue Sky as well. So wherever you are, we want to be, either in your barbershop or your beauty salon, your grocery store, or on your mobile device where you can follow us every day. And also, please subscribe to our YouTube channel at Washington Informer TV, no spaces, Washington Informer TV, where you can watch some of the Let's Talk episodes that you may have missed. We are now in our 6th year. Can you believe it? Our 6th year. So there are lots of great segments that we've had, great interviews, conversations we've had with folks over the last 6 years. So we certainly would like for you to follow us on YouTube. So I'm going to transition now. Lauren's here. Good. Okay. So we are going to, Lauren Burke has a phenomenal journalist who is the founder and publisher of Black Virginia News. I'd like to bring her on so that we can talk a little politics. Lauren, how are you?
Hey, how are you? How you doing? How's it
I'm
going?
good. I'm good. I'm so glad you had a couple minutes to spend with us. I know it's tense in Virginia,
Yeah,
and
just a little bit.
yeah, and I know you've been out there covering. I just wanted you to give us a sense. The election's coming up on Tuesday, but give us a sense of what you've been seeing and what you predict might be the outcome of the biggest races in Virginia, the governor's race. Crazy, what is it? Attorney General,
Hmm.
was sparked a lot of.
Hmm.
So, what's
News.
going on?
Yeah, what's going on is that the Democrats are expected to win at top of ticket with former Congresswoman Abigail Spanberger running for governor. She spent 6 years in Congress. She's running against the sitting Lieutenant Governor of Virginia, Winsome Earl Sears. Every poll that is responsible, there are a few who are not responsible, but many of the polls, the big polls, which would be the Wasson Center for Christopher Newport University, the Washington Post poll that they do at George Mason. We had a poll from Roanoke College yesterday. All the polls show Abigail Spanberger at least 10, well, I shouldn't say at least 10 points, at least 7 points. And it's usually 7 to 10 points ahead. I haven't seen a poll, a big poll that has shown the Lieutenant Governor Winsome Sears ahead. I think, as most people know, this is a historic race. It's two women running for governor. The Republicans are featuring the first Black female nominee for governor, Winsome Earl Sears. And the Democrats, of course, have put forth Abigail Spanberger, who ran unopposed in the primary. So we have two women running, and Abigail Spanberger is largely expected to be the victor in this race on Tuesday by what I would say is a sizable margin. On top of that, it's widely expected, and I would predict that the Democrats in the Virginia House of Delegates are going to pick up at least 6 or 7 seats. If they picked up less than 6 seats, that would actually probably be looking like a failure. But right now, the Virginia House of Delegates is 51-49, very close margin, and they should be picking up a lot of seats because this is really the voters' opportunity to speak out against Donald Trump, and I guarantee you the voters will take that opportunity. At the Attorney General position, we have Jay Jones running against the sitting Attorney General of Virginia, Jason Miyares. And that Jay Jones had been polling ahead by 5 and 6 points for the entire race until October 3rd, when a story came out with regard to some private text messages he sent to a friend of his, a Republican in the House of Delegates, back in 2022. And that story blew up. And quite frankly, because the Democratic Party has no messaging apparatus, not on the national level or on the state level in Virginia, they let the Republicans ride that story for weeks at a time, and in fact joined with the Republicans in their negative messaging against their sitting nominee for Attorney General, and that has greatly damaged the race for Jay Jones. The Democrats, for some reason, have an inability to make an argument, and stand up for their own people. They participate in, quite frankly, the destruction of their own candidates. We saw that with Al Franken. We sure as heck saw that in Virginia with Justin Fairfax in 2019. And we're seeing it right now with Jay Jones. Now, did Jay Jones make a mistake? Sure, Jay Jones made a mistake. Is anybody trying to defend what was written in a private text message that, by the way, was in part quoting a comedy series called The Office? Nobody's trying to defend that. But in this world, in this technological environment, in this digital environment, as Donald Trump has taught us for 10 years, you have to have some sort of response. Even if that response is not coherent, you have to have one. And so what has happened is the polls have flipped, and many of them show the sitting Attorney General, the Republican Jason Miyares, ahead of Jay Jones currently. Whether or not he wins is another topic.
Let me jump in really quickly, because when you talk about standing up, it's interesting because the Winston Searles, has not received the endorsement of the president. What is that all about? Why hasn't Donald Trump? I don't know if you know. I mean, everybody keeps asking.
Yeah. Mm-hmm.
Answer, but what do you suppose is the reason for that?
Well, Winsome Sears has been critical of Donald Trump. So when back in 2020, in the 2020 cycle, obviously when President Joe Biden beat Donald Trump by 8 million votes, right before that cycle started, Winsome Sears was saying publicly that the Republican Party needed to move on from Donald Trump. And of course, he remembers that. And Winsome Sears is really, in a lot of ways, a traditional Republican. She's not quite a never Trumper, but she's not MAGA either. She's your typical Black Republican that says typical Black Republican things, but they are not what I would define as MAGA. So Donald Trump remembers that and didn't want to endorse her. But I think it was about a week ago, he did comment on the race favorable in her favor. He bashed the Democratic nominee for Attorney General Jay Jones, and he said something favorable about Sears, which for the first time, but it was not exactly a full-throated formal endorsement in the way that it typically would happen months ago, would have happened months ago if it was a normal situation.
What do you suspect is going to be the voter turnout? It's been pretty bad over the last few years, last few elections, but what do you expect on Tuesday? And I hear that the early voting, the numbers were large, but what do you suspect?
For early voting, it's been pretty good in Northern Virginia. We have the district that usually comes out a lot is the 1st congressional district, which is Eastern Shore, a fairly white district. It's Rob Whitman's district. That district turns up big usually in terms of percentage of people voting, not just early, but overall. The one that came up last for Harris last year was the 3rd district, which is Congressman Scott's district, last in terms of turnout. And there could be a lot of reasons for that, one of which could just be that Bobby Scott never has any real competition. So a lot of people say, well, why am I showing up? Now, you would say, well, why wouldn't they have shown up for Vice President Harris? That's a good question. But there was a fall off across the country for last year's election. And so the early vote in a lot of the Black districts tends to fall off because a lot of these Black candidates don't have opponents for the House of Delegates races. So, the historic Speaker of the Virginia House, Don Scott, doesn't have an opponent. There is a prominent member of the Virginia House of Delegates who just moved the redistricting legislation, Sia Price. She doesn't have an opponent. So that kind of lessens the turnout a lot of times, particularly when you have Abigail Spanberger running. She's running as Republican light, and I want to attract moderate Trump voters. So if that's your strategy and you're not going for the base, that's going to depress the turnout for Black voters.
And before I let you go, what if you were to list maybe the top 3 issues that folks are resting their votes on, with the concerns that Virginia's? I know that Virginia is a very diverse state, So, but if we looked at maybe Northern Virginia, what are the top three issues that may motivate folks to vote?
The top three issues are healthcare, education, and something around saving democracy or protecting democracy. So
Mm-hmm.
attending, like I attended 3 of Congressman Scott's town halls in the last few months, Newport News, Chesapeake, and Hampton. First question, first hand that goes up, how are you going to protect us from Donald Trump? Then you look at the polls in the Washington Post and for Christopher Newport and everybody else, they ask people, what are your top issues? Top 3, education, healthcare, protecting democracy, some form of protecting democracy, either protecting us from Trump or protecting or some concern about democracy. Those are clearly the top 3 issues. You would never know that, by the way, from some of the commercials, because there's
Correct.
incessant talking about abortion, because the Democratic Party gets multi-millions of dollars from abortion advocates, Planned Parenthood, Emily's List. So they talk about abortion all the time. That's always down on the list. Winsome Sears is talking incessantly about trans and the bathroom issue. Nobody's talking about that. All right, I'm going to go and knock doors alongside. Watch the governor of Maryland, Wes Moore, knock doors tomorrow in Virginia. I can guarantee you that nobody is going to come to that door and talk about trans or abortion. I mean, I absolutely would guarantee it. But I'll update it if I'm wrong. But it's just interesting. But those are the top 3: education, healthcare, democracy.
It's interesting. This is an aside, but I'm reading Kamala Harris's book, 107 Days.
Oh,
and
good.
that was one bit of advice that Bernie Sanders told her.
Mm-hmm.
Don't dwell on abortion. And she did. She did
Right.
it anyway.
Right.
Well, I really appreciate you taking this time with us. Before we go, can you tell folks about Black Virginia News, about the newsletter and what you're doing, and how they can get access to it?
Black Virginia News, if you just Google it, it'll come up right up on the top of the list. But it is at blackvirginianews.substack.com. It is a newsletter that is daily, that reports mostly on all on Black concerns in the Black community in Virginia, in the tradition of the historic Richmond Free Press and New Journal and Guide. And try to do it daily and try to be topical about the things that don't get written about, don't get reported. And of course, that's a lot, as you know, when it comes to the Black community. So it's a lot of fun. It's a few years old. I started in 2022.
Well, I'm just glad, that you're doing it, because folks want to know what's happening in Virginia. And of course, you mentioned the 2 Black newspapers there, but your newsletter is one that will help to keep folks up to date, because we've got some power there in Virginia, and we're glad that you're there to share the story. So I want to thank you so much for being with us. Now, I want to get you back next week, Lauren, if you're available next Friday.
Okay, I have a dental fiasco going on Thursday, but I don't think it's going to be that bad of an appointment, so I probably could do Friday.
Okay, I hope so, because we want to follow up on the election results. The election is this Tuesday. What is that? November the 4th? Is it the 4th?
It's the 4th Tuesday. You're right.
Right, on Tuesday. So yeah, hopefully folks will get out there and vote. We'll have some big numbers to talk about, and some interesting results to analyze. So I appreciate you taking the time with us.
Thank you so much.
Thanks, Lauren. All righty. Yes, Lauren Burke, Black Virginia News. Please check it out if you want to know what's going on in the state of Virginia. She's out there covering from north to south to east and west of Virginia. So, and the Black community, as she reminded us, very often does not get the kind of coverage that we feel as though we deserve. That's why the Washington Informer's here, and that's why we're glad to have her on board. We're going to transition now to Wellpoint and bring on our guests from Wellpoint, Adrian, who is the CEO, Adrian Jordan, the CEO and president of Wellpoint, as well as, let's talk with you, Adrian, first. Let's get this conversation going. How are you?
I'm doing well. Good afternoon. How are you?
Trying to keep it together here, It's just some crazy times that we're in right now. And even when it comes to healthcare, folks are, again, biting their nails and sitting on sitting out, just trying to figure out where are we going as a country. So I wanted to one, introduce you to our viewers. You are a native Washingtonian, I understand, leading DC Wellpoint. Tell us a little bit about Wellpoint DC.
Sure. Wellpoint DC is one of the three managed care Medicaid organizations in DC, serving about 200,000 individuals. I stutter on that because, as you know, because of the One Big Beautiful Bill and budgetary impacts, the roles in Medicaid have been reduced. We have the pleasure right now of serving nearly 65,000 residents, providing healthcare needs for them across, all 8 wards in DC.
How do people get to Wellpoint to get care? What is the process?
So they'll start through enrollment with the Department of Healthcare Finance. You can go onto District Direct, as is the district's website portal, to determine eligibility. And once you go through all that and you have been approved for Medicaid, you can either select one of the 3 managed care plans or you'll be auto-assigned.
We're talking about health literacy, and as I listen to you, I think about some of the terms that you just used, and so and they just escape me right now. But just signing up and some of the terms that you use, and so we want to kind of dig into that to figure out why this is so important. People, just I'm sick, I need a doctor, I got an appointment, they gave me some medicine. It's kind of basic how people talk about healthcare. But what do you think is important for people to know when it comes to health literacy?
Well, just being able to read doesn't mean you understand or can comprehend some of the things you just mentioned. Take some medicine. Well, take it as prescribed. So we look at those kind of things because healthcare still in this country in DC is still very self-directed. We try to be a helping hand, but when there's so many different impediments like literacy or housing or food instability, the hierarchy of needs changes the priorities. So we look to see what some of those determinants are, and we try to look and see how can we partner with trusted community-based organizations to help us get that message out there.
And the message being, because if people don't understand the prescription or the medicine, i.e. prescription, if they don't understand the language that's used, sometimes I look at tablespoon and teaspoon and trying to figure out which is which, right? I'm just talking personally. How does Wellpoint really help in that?
Well, we want to make sure folks know that they have the resources that are local and that are covered through Medicaid. We have many points of entry, obviously digital on the website. We have storefronts on 8th Street Northeast, and we're opening a new one on Marion Barry Avenue. I was going to say Good Hope Road, where folks could come in and talk to a person to help them navigate their healthcare journey. We have social workers, we have case managers, but again, you have to know that these things are there. And when you have to fill out these forms, and they are probably 20, 30 pages, and you just get glossed over. So trying to have that human element so that people know what services are available and paid for, quite honestly, through the tax dollars that we all pay.
Is there something or some issues that you find kind of repeat themselves when you're talking to, or your staff are talking to patients, that you find you're always having to clarify? Some things that sort of always misunderstood.
One, just who they're insured with. A lot of the times folks don't know. They know they have coverage, but they don't know who it's with. But we have a no wrong door approach. If you're not our member, we'll redirect you to who your other MCO, they are. And then the other is just understanding the benefits that are existing. I mean, all of our members get a really thick book that has everything that you can imagine in it, but no one will read it until you actually need it. And then it's a daunting task because you're in desperate need of support and you have this giant book. So, we invite people to come in. And like I said earlier, we try to do a no wrong door approach. I don't care if you're a case manager, social worker, or myself, everyone should be able to help the enrollees who are in our plan.
And once again, I mean, the people are utilizing, I think, different healthcare providers, but how do individuals get to Wellpoint, and who qualifies to be served by Wellpoint?
So that changes depending on the budget cycle and the
Yeah.
federal impacts that we've had. But typically, those individuals, and it's generalizing, who are at about 133% of the federal poverty line and lower qualify for Medicaid.
Going back to the whole issue of and that's the you talking now, that's a big one. I was going to move on, but with the threat to Medicaid, right? I have heard so many people in DC confuse Medicare and Medicaid. To me, that's one of the biggest misunderstood or most misunderstood types of insurance that DC residents that are concerned about, particularly when there seems to be this threat to Medicaid. So explain, if you can, just a health literacy lesson right now, the difference between the two.
Sure. And at a really high level, because there's some nuances to this,
Yeah.
Medicare is predominantly for our elderly and age population. So the older of us, and Medicaid is for those from a economic standpoint, those who are low income, who are at that federal poverty line that I mentioned earlier, that 133% and below.
Mm-hmm. Okay. And so, but there are some cases where people are eligible for both. Is that correct?
Correct. And see, now we're making it really complicated because you have those dual eligibles,
Right.
because they do hit certain criteria for both, and you're right on. And then they would be in what we call a DSNP plan, a dual special needs program.
Okay. So how do you envision the future of health literacy shaping the next generation's relationship with healthcare?
I think it's helping people to take charge and giving them the power to control their healthcare journey. I don't see healthcare in the country changing anytime soon. It's always talked about, even at the national level, how we're going to transform healthcare. But I think this system, the American system, is here to stay. So we have to make sure people understand what that is. So, like you just said, what's the difference between Medicare and Medicaid? The health benefit exchange, Obamacare created the exchange, and commercial insurance, right? Just that base level. What type of product do I have? And once you understand that, then you can have the tools to be successful in navigating care with your doctor, right? Because that's the other layer. We're the payer for you. If you have our plan, we're there to help you navigate with your providers, your specialists, and even some of the nonprofits that we work with, like Food and Friends, if you have food insecurity. So, it's a big task, but the first step is, well, what kind of healthcare do I have, and how does it work? And what network of providers and tools and resources do I have?
Another question, because we were talking about the next generation, I just wanted to throw this in there because, the rules or the law changed where, young people could be covered by their parents' health insurance until I think it was the age of 26.
Mm-hmm.
And so a lot of young folks don't even think about, coverage until it's that time. Of course, some, are not covered by their family's health care. So what are the opportunities for, say, those below 26 and under?
So, it's the same, but we also are looking at different approaches, like digital approach. So we have a Sydney app. So instead of just carrying around this card, you have it on your phone, right? A lot of young folks, that's what everything is done through digital apps and portals. But also we found, like you just said, most young people, I'm healthy. What do I need to engage in the healthcare system for? But they will get vitamins and supplements, and a lot of those will be prescribed by some of these online companies. We're working with some of those like LabCorp and Quest Diagnostics. So even though you didn't get to the doctor, we're still seeing that you are getting some level of care that you're just deciding on your own. So we're not losing those gaps as well. Actually, we just had a great conversation with the DC Primary Care Association last Monday about that and how all of us can work together to connect those dots for young people and old people and anybody in between who maybe they don't want to go through that traditional way of, I go to my PCP, they talk to my insurer, they want to do something different. So we're always looking to close the gaps, no matter, what age band you are, but also meeting people where they are, social media, apps, and all the other digital tools that are available to us.
And is WellCare, I may have missed this, because you mentioned your locations on H Street. I know you're getting ready to open another one on Marionberry Avenue. Is this a walk-in situation where folks can walk in and sign up, or do they have to go through the city program.
So the beautiful thing about our address at 609 8th Street is that we can't enroll you. We can help you get
Okay.
there. But the district's ESA, Economic Security Administration, is right around the corner. So we just walk them right around there so they can sign up in person.
Wonderful, wonderful. Well, I appreciate you telling us a little bit about Wellpoint and how we're trying to address the issue of financial, I keep saying financial literacy because we were just came out of Financial Literacy Month, but health literacy. There's just so much people need to know in order to make sure that they um, can take care of their own health needs and do it from a sense of knowing what the terms are and what to ask for. People are intimidated a lot of times when they go to see a doctor. They're
Yeah.
just they're just sick and they want to be fixed. And the language doesn't always work for them. So, and they don't talk much. At least that's what I understand. So I think Wellpoint, that's something you all are focused on, correct?
It is, and especially in our, as I mentioned, our partnership with the DC Primary Care Association, and we created an integrated value-based deal with 7 out of the 9 federally qualified health centers. So your Unities, your Mary Centers, Whitman Walker, so that we're all talking together and we're not in silos, so that we get one unified message across. And then I'd be remiss, we're talking about education and health literacy. We created a Partners in Education program, and we're working with some of our charters in some of our high school so that they understand, what that journey looks like for them, even at that young age. Because we want to make sure all our kids get their vaccines, their well child visits, and immunizations so they can stay in school as well.
Yeah, it's been a long time since I was in school here in the district, but I know even when we used to take our health classes, right, we never talked about health coverage, and rarely really talked much about health. I don't know what's going on in schools today, but it's real important, I think, if we want to change the health, what's happening in the Black community as it relates to some of the health issues that we are addressing, the disparities, to start really young. And I'm glad that you all are doing that. All right, Adrian, well, I'm going to let you go because we're going to talk now to Janita Finley, who is the founder of Medical Ascension, because that feeds right into, what young folks are being taught to do. And you can stay with us, or if you got to check out, no problem. But I'm excited to bring on Janita Finley, founder of the Medical Ascension DC. Janita, nice to meet you.
Thank you so much for having me, and it's nice to meet you too, Ms. Barnes.
Yes. So tell us about Medical Ascension DC. What is that?
Sure. So Medical Ascension is a healthcare career readiness and a workforce development program. We have 2 main goals. The first goal is to really introduce our young people to healthcare through learning real-world clinical skills to encourage them to want to go into healthcare. And the second goal is to activate them today, not tomorrow, to become our future leaders of healthcare and wellness. And we do that through a bevy of ways, including our Medical Ascension community health stations that you might see out in the community, where our trained, go ahead, I'm sorry.
I missed that part.
Yes,
what is
I can repeat it.
What is that first thing?
So our first goal is to really get them interested in healthcare.
Right.
And so we do that by training them in clinical skills. And so they learn real world clinical skills with us. Like they learn how to take blood pressure. They learn how to do eye exams. They learn how to do BMIs. They learn how to do ear exams. They learn how to do these real world clinical skills to encourage them to want to go into healthcare. But more importantly, they learn what the numbers associated with those skills mean. So a lot of times, I don't know about you, you look really fit. I need to get fit like you. I go to the doctor and the doctor says, Nita, your BMI is still sky high. And then he just walks out the room because he's busy. He's got to see a lot of people and tell a lot of people like me that our BMI is sky high. What our young people learn is what those numbers mean and give real world concrete information of things and ways I can change my BMI. And what I mean by real world, for example, sticking with the BMI example, don't tell someone just to go to gym. You don't know what my environment is like, right? So we train them in motivational interviewing to ask, like, what is your environment like? Do you have the financial resources to afford a gym? Okay, if I'm a security guard and I'm outside in the parking lot 24/7, telling me to go to the gym is not going to be very helpful. However, maybe telling me to get up and do walks around the parking lot more often might be helpful, right? Also asking people, like, what do you enjoy doing for physical activity? Oh, you know what? I like to dance. I like to garden. Okay, why don't you do that more? How often do you do that? I do it once a week. Why don't you do it 2-3 times a week? Do you think you could fit that into your calendar? So, like, training them in real world clinical skills along with activating them to become their health and wellness leaders for today. And some of the examples that we do when they get activated is our medical essential community health stations. So throughout the district, with a huge focus on Ward 7 and 8, we have what we call medical essential community health stations, where our young people are actually manning these community health stations. They are doing health screenings. They're doing blood pressure screenings. They're doing BMI screenings. They're doing eye exams, visual acuity exams. They're doing this, but also sharing what the numbers mean and ways that you can improve your numbers if you need to improve your numbers. Now, they're not treating and diagnosing, so I want to dispel any myths there, but they're just providing the same information a community health worker would. I talk fast, so please stop me.
Oh, yes, you do, but I will. So when you talk about young people, what age group are you talking about?
So when we started in 2020, we started at the height of the pandemic, and we started with middle school and high school youth. And what we in one cohort, and what we learned was the program was such a runaway success that a lot of times moms would send their 8-year-olds, which is elementary and not middle school, into the program with an 18-year-old, which would be a senior. So we had to separate the groups into middle school and high school because we didn't want to have the mixing. Fortunately, we've recently been able to bring back our middle school cohort. So we will have a middle school cohort in the summer running, and we will continue to have our high school cohorts running throughout the school year and the summer.
And when you say send them, where are you doing this, in the school, or where are you doing this training?
So one of our very strong partners is Far Southeast Family Strengthening Collaborative. So right next to Anacostia Bus for Employees, across the street from the big chair, we do all of our, not all, the majority of our clinical skills training is in that training room there. That's where we do most of the training. We have another huge partner, Trinity Washington University. I would be remiss not to mention them. So they get to go into the simulation lab there. They have a maternal health and a nursing simulation lab and an OT simulation lab. How many people even know what OT or occupational therapy even is as adults, right? So they get that real experience as a young person in high school, in middle school, through those different partnerships that we have. We have partnership with Children's National Hospital where they get to work alongside the physicians there. But I'm going to stop. So you ask the next question because I can go on and on, as you can tell.
Is there for somebody that's listening, right? And they, first of all, how are these young people, interested in medicine? What inspires them to become a part of your program?
That is such a good question. When we first started out, our young people were all interested in medicine, right? The ones who were coming to us, they saw the name Medical Extension, they went to the website, medicalextension.org, so they were all interested in medicine. Around 2022, we noticed something changed. A lot of the young people who were coming to us were not necessarily interested in medicine, and we did not turn them away. They were coming to us because they had heard about the coaching elements that's a part of the program, where they get to coach people with diabetes, where they get to coach people with hypertension, and they have family members with diabetes. They have family members with hypertension. So they wanted to come to gain the information to be able to help a family member or a community member or a loved one with the disease process to be able to manage it better. And that is through our partnerships with different universities. And so what happens, interesting though, they'll come to us, I'm not interested in medicine, I want to learn how to do hair, for example. Somewhere along the way, when we do our award ceremony, I'm announcing, oh, Sanaya now wants to be a nurse. Wonderful. Because of the exposure.
And have you seen that? Have you seen sort of the journey of young people coming through your program and actually going into medical fields?
Yes, we've had a lot of our young, so just to give us a little feedback real quick, or a little background real quick. We started in 2020, so a lot of our young people have not been able to complete their educational process yet. However, we have a lot of our people who are entering nursing schools now, who are finishing up college, who are talking about going to med school, who are telling us about, I didn't know about OT until I went to Trinity and I'm in high school now. I'm going to go to Trinity Washington University because they have a cool program there where you can become an OT and everything within a certain amount of years. So we're seeing occupational therapists. I'm sorry. Occupational therapists. I need to do better.
University, so you lost me there. Okay.
No, and you know what? That's a problem with me because I'm learning, can I speak in acronyms? Yes, occupational therapy is what I meant to say. And speaking of health literacy, here's a little note. When you were talking about Medicaid and Medicare with Mr. Adrian from earlier from Wellpoint, who is one of our sponsors, which we're very excited to have as a continued sponsor. One thing that we always say for health literacy purposes to teach our young people the difference between Medicare and Medicaid is Medicare is because we care for our seniors, and Medicaid is because we need to provide aid for those who need the financial aid. Just little mnemonics there for that health literacy purposes.
Love it. Love it. Yeah, it certainly does. And it sticks, you know, that's something that would stick with the person. They'd probably remember that. So once a young person is involved in your program or enrolled in your program, how long does it, is it a year? What's the
our cycles, so our school year cycles, which we have our fall and spring, our fall one is ongoing right now, and our spring was ongoing in the spring. Those are 9-week cycles. We meet twice a week, but we often tell our young people, come once a week. You know, we understand you have other things. You might be an athlete. You might be interested in other things, which is good. We want you to explore. This is the time for exploration. Our summer cycle is 6 weeks long, and it tends to be 4 to 5 days a week. It is a true commitment. The summer cycle is the one where you will see them all over the community doing their medical-centered community health stations. This past summer, after they trained with us for about 3-4 intensive weeks, they were actually at a lot of Wellpoint events that they did in collaboration with Horton's Kids, where they were actually running their medical-centered community health stations at Wellpoint events.
So how do people receive them? I mean, you got a middle school student offering to give a blood pressure test to, an adult. Does that work? How does the public receive them?
So our middle school students, we don't send out. Our middle school students, we allow them to stay cooking. We're still cooking on them, right? Our high school students, we do send out, and you would be surprised. One of our partners is the Ward 8 Wellness Center off of Alabama Avenue. And so every summer for the past 3 or 4 years, they go there and they provide the screenings through our medical-centered community health stations like clockwork right before their lunch. And the very first session, what we find is the seniors oftentimes are like, okay, this kid, what are you about to do? But by the time the second session, I said, hey, can you bring more students? Because I wanted to go even faster, and I want to be able to go do my fitness stuff. I wanted to stop by here. And then by the time they're there for the third or fourth screening, because they come every week, and they start to bring their own books so they can track their blood pressures from week to week and track if they're making changes. They'll start to take photos with the young people as if they're celebrities. I learned really early, I'm not one of the celebrities. I give them the photos like, no, we want you to take it with us. I was like, oh, you want them, not me. Okay, I got it.
So in the case where a high school student might take someone's blood pressure and find that it's extremely dangerously high, what are they supposed to do?
So there are, what you're talking about is like those emergency levels for hypertension, right? The crisis level. They give them immediate feedback. This is what you need to do. You need to go to the nearest clinic or the nearest hospital because this is what your blood pressure is. They will also ask them additional questions like, what is your blood pressure normally, right? Are you on blood pressure medication? Did you take your blood pressure medication today? And those questions are not to treat or diagnose. Those questions are really to make sure that the person remembers, oh, I didn't take my blood pressure medication today. So when I go into the emergency room or the next urgent care clinic, I will let them know my blood pressure is really, really high and I forgot to take my blood pressure the last 2-3 days, right? So they are trained to know what an emergency is, and not just for the community health stations, but for their friends and family members as well that they learn these screenings for. So they can make sure if they're doing it at home, hey mom, your pressure's high. You need to go to the emergency room or the urgent care clinic right now.
Wow, it's nothing like having a little doctor or nurse in your own home, looking after you. That's such a added benefit of the program. So how do young people enroll? How do they get involved?
Yeah, so they could go to our website, medicalcenter.org, and on the website, you can enroll there. We have to change the language, unfortunately, because we have 110 applicants this cycle and only 35 seats, and I'm a bleeding heart, so we always go up to about 45. I somehow make it work, which means we've already started our waiting list for the summer cycles. And so we can't use the word enroll anymore, which I would love to use, is just because we don't have the capacity. We're working to build the capacity, but we don't have it yet. So we use the word apply now, just because we can't guarantee you'd be with us this fall. Our goal is to make sure everyone who applies at some point can participate before they graduate high school. That is our goal.
So before I let you go, Janine, I just want to ask, I mean, this is an amazing program, and I would love for the Washington Informer to do more to sort of highlight some of the young people that you're working with and some of the great stories I'm sure that come out of the work that you all do. But how did you decide to create this program? What was it that motivated you to create?
Yeah. So looking around the country, there's always conversation around workforce development, career readiness. And then I was talking with my dad, who is actually the executive director of Company Recycling Center, who's been in workforce development I want to say his second life, because before he was all in for-profit world. And he would always tell me, like, there's so much workforce development done on adults, but if we could get them when they're young. And I said, well, what is the one field that if we could get most of our young people involved in, that they could actually have real life, thriving jobs financially? And it was healthcare, because healthcare is the largest growing industry, whether it's healthcare or something associated with healthcare, is the largest growing industry, and is going to continue to be the largest growing industry, they say, at least until 2050. So we wanted to create something that would encourage students to do well academically, as well as make a change in their lives when they finish. And that's why we created Medical Ascension.
Wow. Well, kudos to you. Congratulations. You're really helping to seed the careers of young people in our community, and hopefully sort of contributing to the wellness of our community. So I appreciate you being with us and sharing more about Ascension DC. And we look forward to covering more of what you all are doing in the days and weeks to come. So thank you very much for being with us. I think we're going to move on now. We kind of lost Nita. Okay, there, you froze on us. But anyway, thanks a lot. Didn't get a chance to say so long, but see you. Hope to see you again sometime soon. I want to now oh, there you are. Yeah, I just wanted to sign off, and thank you so much for being with us. All right. I think we lost her, but thanks a lot, Janita, for being with us today. I want to bring on now Jimmy Williams, who is the president and CEO of the Washington, D.C. Literacy Center.
I'm here. Good morning. I think it's good afternoon.
Yeah. Oh, right. And I think it's not just financial literacy and health literacy. Now we're looking at digital literacy, because we're having a couple of little issues here. But Jimmy, thank you for coming and talking to us today about your Washington, D.C. Literacy Center and all that you do. Tell us a little bit about what happens there and why this organization was created.
Sure. So first, let me start why we were created. Washington Literacy Center, we started in 1963 in a church basement, and it was an answer to the civil rights era, when a lot of mostly African-American residents of DC didn't know how to read at all. But fast forward to where we are now. We're 63 years old, almost 63 years old. But what we do now is, with the evolving economic climate, the years that have passed, we focus on all things literacy. But reading is still at the core of everything we do. So as you mentioned, we serve adults 18 and over, but we focus on reading, math, digital literacy, health literacy. So all things literacy, but we recognize that there's a lot of things that you need to succeed or to move in DC or this world, but reading is the core. Math underscores that. But what we do is fill in all of that. So our goal is to have a complete adult when you come here and address all of those issues, whatever your barriers might be. And that number in DC is high. It's really about 1 in 4 adults that in Washington, DC, that's 119,000, struggle with literacy. And I know today we're focusing on health literacy, but I just wanted to say that so you understand just how serious that problem is. It's 1 in 4 for adults when it comes to reading, and 1 in 3 when it comes to math. So that's roughly 179,000 people, and all of them are, with levels below the first grade level.
Yeah, I know I was going to ask you that question because it's a pretty serious issue, and I've had conversations with folks who work with children in the school system who sometimes complain or worry that they can't get homework help or help with their parents because their parents can't read. And so, and then of course, we look at our literacy rates, which I think are improving in the district, but there's still a major problem. And so it's how has your organization, Washington, D.C. Literacy Center, I mean, what kind of successes have you seen with some of the work that you all have done?
Because we've evolved, we've seen a lot of successes. I mean, the number of students or adults that we serve is small, but the success that we see have is like one of the biggest success I'm proud of is support your family literacy, because you're right, the K through 12, those numbers have moved. The adult literacy rate has stagnated, not that much, but we want to work with the adults so they can continue to work with their youth, the children that are K through 12, but also to make sure that they are parents and that the parents who support the students, whether it comes to medical assistance, doctor's visits, encouraging and supporting their education. So what we do is we try to address those barriers so that we're all moving together, so that the literacy numbers that I'm really happy to hear with DC that they've actually improved, but that we have as a city, especially when you talk about wards 4, 5, 7, and especially 7 and 8, that we have the adults as well as the youth and we're able to support them. And especially when it comes to medical care and working with groups like Wellpoint, because it impacts the life expectancy rates.
Yeah, that is where I wanted to go next because I'm not sure, or maybe you can tell me when when the Literacy Council actually started looking at, or the center started looking at health literacy. I mean, was there something that you as an organization recognized that where there was a need, or was it the relationship with Wellpoint? What was it that made you decide to focus on health literacy?
Actually, it started before Wellpoint. Two things happened. We had a lot of students, including, unfortunately, some of our adults died, and it was due to a lack of education. By the time that they sought medical assistance, it was too late. The other is we would have adults that would bring medications and pills here because they didn't understand how to read them for assistance, how to do it. And then our instructors noticed and our counselors noticed that they were asking, bringing more papers to understand medical care, going to the doctor. What did it mean when the regular one pill that you take was switched out with a different medication? And it was so complex. And we did that with, I believe it was George Washington University years ago. Wellpoint is our most recent partner and one of our strongest partners. And so I think Wellpoint really we started working to address what I call 21st century needs. And that includes um, health portals, juggling health care, getting babysitters, shift work issues. And so together, I think we work to what I call to make it address all the modernized issues. I heard the robust care about conversation about Medicare, Medicaid, all of those for somebody struggling with literacy, and not to mention how fast the situation changes, it's overwhelming for them. So to answer your question, yes, we're working closely with Wellpoint, but we've been doing it for some time.
And just like when we just talked to Ascension DC, we talked to Anita, who talked about young people, learning about medical careers and being able to provide services. But we still going back a situation where, let's say, a parent, right, has a child that has medical needs, but the parent can't read. And so where do they get that kind of support when it comes to, or is that one of the things that you found that the center really helps with when, you have to take medication so often and the amount that you need to take and the visits, that could be a real messy situation when it comes to health literacy.
Denise, you're right. It's extremely complex.
Mhm.
We take what I call the airline. When you fly a plane, they teach you when the oxygen mask drops and you have a kid next to you, put the mask on yourself first, and that way you're better able to situate your child or the kid that you're traveling with. Uh, we really do focus on, say, with the parent. the more we arm the parent, we find it's multi-generation benefits. So if the parent is better able to read and better understand the questions, uh, and ask informed questions, what is this medication for? How often do I take it? What if there's a conflict? What do you mean you want me to go to the online portal? Well, when we do that, we find that that multi-generational approach permeates to the kid and everyone else in the family. And a lot of times it may be the grandparent, it might be the parent or someone else in the household. So our classes are really geared around we center the adult so the adult can center the family. And with other partnerships like Medical Ascension and all the other good things that Wellpoint does, our goal is really just to be what we call the nucleus, to make sure that at the center of all that is the ability, because none of this will function. You can't, if it's, I forgot Medical Ascension, if you want to go there, you have to be at a reading level. If you are participating with Wellpoint, you have to be able to understand where you are in the reading and know where to get assistance and have a household that's also informed.
So that's, I'm glad that we kind of had everybody here together to tie a bow around this whole health literacy issue. But where does the relationship occur for the patient who may go to Wellpoint but also needs maybe some support on the literacy part? I mean, how do you all coordinate that kind of support for the patient?
Well, you know what? Thank goodness for Wellpoint being centrally located. I can tell you, Wellpoint just had a fair, like a job fair, but that gave us an opportunity to show up at that fair and talk way more, far more than just about jobs. But because Wellpoint knows we exist, we're actually planning a health fair with Wellpoint sometime next year. So it's really keeping that drum cadence to let them know we're there. Wellpoint knows to refer people to us. We have the partnership that goes over to Medical Ascension. So we really keep that. I call it the steady drumbeat of letting people know we're there. And I thought it was particularly fortuitous of Wellpoint because we're 62 years old. They approached us and said, "You've been around a long time. Here are the issues." And I noticed that the president and CEO Adrian was writing about literacy in Ward 7, and that's rates in Ward 7, literacy rates of 40%. So a lot of the arrows point to us to say, here, you all be the main, one of the main drivers of literacy, especially low literacy. You have other institutions that focus on literacy, but we focus on the most profound. I hope I answered that question.
Yeah, I guess what I'm really trying to figure out is if a local resident, walks into the Wellpoint facility on 8th Street, and someone observes, right, that there's some issue there with being able to read or to understand what they're being given or told to do, right? How does Wellpoint refer that person to the literacy center? What is the connection? How do you all connect?
That's exactly it. Wellpoint would refer. I mean, we have staff here that are trained. So we actually get a call and say that we had that from Wellpoint or one of their employees that says we have an adult that's struggling with literacy, struggling with reading, and they're not able to understand their prescriptions. What can you do? We have one-on-one tutor. We have small classes. So the first thing we would do is match them directly with the tutor, unless it's an emergency. And if it's emergency, that's a whole different track of work. But if they're noticing, and that's what the beauty of this arrangement is they help identify people with those problems so that we can put them and help them educate, what I call educating up, Denise.
Before we go, Jimmy, I just want to ask you, I mean, people are embarrassed when they don't know how to read. I remember hearing Doug Williams, from the former Washington Redskins, who I think it was Doug. No, it wasn't Doug. It was
Dexter Manley.
Dexter Manley, right, who exposed the fact that he was did not know how to read, and so when you have people who really will come out and talk about it, it may inspire other people. But what would you say about people who feel like they might be stigmatized or embarrassed about their inability to read, and what they should feel and do about it?
Well, I've been here 8 years, Denise, and I'm glad you asked that question. And so we recalibrated how we did things. Before we were known as just the literacy center. We teach people who can't read. That's
Mhm.
not what we do now. We have a lot of classes. For example, we have what we call Learning Skills for Life, which is a professional bartending class, but it's really a 5-week program with so many different parts to it. We have another one, Jumpstart to Literacy. All of those teach so much more, and they bring a larger group of people in. And so our goal is, let's provide workforce, let's provide skills, let's teach financial literacy, digital literacy. And when people are comfortable, they self-identify. So we will have a digital literacy class, and someone, after they've been set there maybe 5 days, will come and say, well, actually, I can't read. But if we didn't have those gateways, those positive gateways, we would not be able to do it. I'll be able to first, and let me just shamelessly add this in. Now, right now, organizations like ours that do this, that are innovative, that find gateways to educate people and bring them to literacy, we're struggling with this funding. It's killing us. And it means that every year, all of these things that I talked about, we're able to educate fewer and fewer people. And our goal, with
Wow.
numbers that we see in DC, again, I'll repeat that number: 119,000 people reading below the first grade level. And the whole shame issue in what we do. Um, at our high point, we'd bring 500. We're probably this year probably going to bring maybe 50, and because of funding, we hope to do more. But to answer your question, we have gateway classes that educate all, and then we redirect those that need it most.
Well, no, it wasn't shameless. It was probably one of the first things we need to talk about, because you can't provide a quality program on peanuts, right? You need dollars and support. And how can people reach out and support the Literacy Center?
Yeah, they can go to our website, washlit.org. That's washlit.org. Or you can call us at 984-0000. But the easiest is washlit.org. You can find everything on us. Everything we have is WASHLIT. But we understand people have problems with literacy, so you can also call us directly.
Yeah, we're going to talk about this more. I'm going to let you go now, though, Jimmy. I appreciate the conversation, but talk about this a little bit more.
I would love to, Denise, and
This
thank
is
you.
one of my passions. So, like,
Yeah.
like my daddy said, if you can't read the Washington Informer, you can't. You can't. We do the spelling bee. We do things that we hope will encourage people to read, especially young people. But you've been in this for a while, and so collaborating and looking at some of the issues and telling the success stories. There's a YouTube guy I saw once who I think you may have talked about it, who taught himself how to read in his car. I think he was driving Uber or something, and every day he would just stop and read a book or learn to read this. I don't know. There's stories about how people sort of break through that. And we want to highlight those people and maybe encourage others. So I look forward to talking to you. And then I'm just thinking out the box, but how AI is good or bad for this, what these have done to either help or destroy our ability to read, what we're doing and not doing. So there's a lot more we can talk about.
Well, let me say this real quick. I
Okay.
really appreciate everything that you all have done. I mean, we use your newspaper to teach. And so you're concerned with literacy. We've talked about it before. AI is actually beneficial, but I'm looking forward to continue talking. Everything that we do with Wellpoint, all of that, we're all working together to solve this problem. So
Right.
thank you very much, Denise and the Washington Informer.
My pleasure. Yes, it takes a village. All right, Jimmy. Thank you so much, and
Oh,
I'm wishing you the best with the Washington D.C. Literacy Center. We need you, so we'll
all
we'll
right.
talk soon. All righty. Have a good one.
Thank you. You too. Thank you.
So from the pulse of Virginia's elections to the everyday power of understanding our health, we highlighted how informed voices and accessible information uplift our community. At least I feel uplifted. I know that there are people that are out there trying to make a difference to provide affordable health care, to make sure that we understand the issues and why we need to vote. How young people can learn more about medical care and how literacy is so important in this whole process. But yet people should not be embarrassed or ashamed, but there are resources out to help them. So I hope that you all enjoyed this show. If you have other story ideas or a question for our next live segment, please feel free to reach out. Let's keep the conversation going. And I want you all to have a fun and safe weekend. Watch out for the goblins. What was that? Oh, yeah. Watch out for the goblins. And Jamon has just reminded us that on Saturday night, our clocks go backwards, which I couldn't quite figure that one out. I don't know why I was so confused this year, but maybe it's age. I don't know, because my clock is not going backwards. But at any rate, Saturday night, remember to turn your clock back. I think you get do we get an extra hour of sleep? We get 1 extra hour of sleep. You can tell I need it. All right. So thank you for tuning in to Let's Talk, and we will see you soon. Take care. Where do you come to?